Hello and welcome to the Charlotte Maternal Child Health Work Group Crucial Conversation Series. My name is Dr. Alicia Dahl, and I am an associate professor in the Department of Epidemiology and Community Health at UNC Charlotte. I'm also co-director of the MCH Work Group along with my colleague, Dr. Lorenzo Hopper. We are pleased to bring you this presentation today in partnership with Mecklenburg Birthing Connections, Mother of Ease, and Smart Start of Mecklenburg County. Our topic is going to focus on Black Birthing Matters. Who are your providers of care? I'm excited to turn things over to our moderator for the day, Racquel Washington, who is also a doula. She'll be guiding the conversation with panelists Kris Elle, a doula, Dr. Pamela Cobb, OBGYN, and Nicole Parchment, certified nurse midwife. Thank you all for being here today, and please feel free to send us questions for the panelists. Thank you.
And a lot of times that's not a time where folks think about being able to have and access doula support. Um, that's something that anchors me in the work. That's really important that folks feel supported throughout all of their parenting transitions and however their journey ends. I'm going to pass it to Kris. I'm excited for you guys to meet some of my other friends that I have here with us. So, Kris, I would like you to start out by giving us a little introduction. Tell us about who you are, what brings you to the work, and then how you show up. What is a doula?
Right. Hi there, everyone. I'm Kris. I am a certified doula, certified lactation counselor, and the founder of Mother of Ease, a Black maternal and family health company whose primary focus is the birthing experiences of Black folk. I've been married to my best friend for almost 17 years, and together we have welcomed 5 beautiful children together. I really anchor myself in my layers as a child of God, as a Black woman, as a mother, as a wife, as a daughter, sister, friend. And that really inspires me and influences me in the care that I provide to my community. My personal journey along the childbearing continuum began over 15 years ago when I was pregnant with my first child. I was 22, I was newly married, I was far away from home, and I felt healthy. I felt great throughout my pregnancy, and my prenatal scans showed a healthy, thriving baby. But at 36 weeks, I was put on bed rest, and after measuring small, and 37 weeks, I was induced. It didn't make sense to me at the time. I had no frame of reference for options of care. I didn't know what questions to ask. Like something that we use as doulas is this acronym called BRAIN, where you go through a series of questions when you're presented with care. You might ask, what are the benefits of this procedure? What are the risks? Are there any alternatives? And is there, am I feeling anything in my intuition that makes me think that maybe there's a different course of care? What if I say no? And what if I say no, not right now? And how will I be supported through that? And so I was not empowered or prepared to advocate for myself. And that first journey to and through birth for me really inspired me to get a better understanding of physiologic birthing experiences and with how to interact with our American systems of care. The day that I gave birth, I was introduced to midwifery care. A midwife caught my baby. I had never heard of a midwife. And when I went to journey my next pregnancy, my lovely OB worked in a practice that had an elevated midwifery care as well. And she was really busy. And they asked if I wanted to see her midwife. And it was the very first time that I experienced what is possible in birth care. And it changed my life. So before all of this, there was before there was me as mother, there was my mother. My work is deeply, deeply rooted in the narrative of my lineage. My mother gave me a profoundly beautiful love, one that she cultivated despite not having it passed down to her. And her stories and my grandmother's stories really inspire me, and it's the essence of the foundation from which I stand on. I carry their legacy and the legacies of Black women who have lived and birthed and survived on this soil, often without access to societal support and generational abundance. And my work is to honor them by helping our community flourish, elevating our access to joy and to comfort and safety and to dignity. And I am the woman and the mother and the doula that I am today as a living spirit of restitution for them. A doula is a non-medical care provider trained to support folks as they navigate significant life transitions and events. Doulas provide emotional, informational, sometimes spiritual, often physical support when they're serving in person, think like massage. And in all contexts, they highlight good comfort and coping techniques, as well as advocacy tools to empower their clients and families along the way. Doulas do not replace medical care providers. Instead, we serve alongside them, offering a compassionate, non-clinical layer of support. There are many kinds of doulas. There are abortion doulas, bereavement doulas, fertility doulas, birth doulas, postpartum doulas, people who identify as full spectrum doulas, and there are also death doulas. Specifically, as a birth doula, my job is to support my clients through pregnancy, labor, and the early postpartum period. Many folks connect with doulas long before birth, receiving prenatal support for weeks or even months. I've had people contract me a week after they have a positive pregnancy test, and some who find me in their third trimester of pregnancy. We support births in homes, in freestanding birth centers, and hospitals. Most birth doulas are independent practitioners, and while some work in pairs or collectives or with agencies, some are hired by hospitals and others volunteer in various birthing settings. Some have studied in professional training programs, and others were birthed into this work. My personal approach is deeply rooted in what I call the nurturing of what feels like a good home, a place where you can have open dialogue, where you can feel free to be yourself. I really prepare the table and I light the candles. And so when my people show up, they can relax, they can enjoy, they can cry, and they can laugh, and they can learn and share, and they can birth, and they can live in peace. How I work as part of a care team with other providers of care, whether I'm in service to a client here locally in Charlotte, North Carolina, or I'm on the ground in another state offering travel support, or I'm 100% virtual with a client, I meet my clients' care providers. I meet them in person, or I meet them over a device and Wi-Fi. I go with them physically, right? Or again, virtually, to at least one primary care provider appointment. And I follow up to thank providers. I send snail mail. I find that introducing myself ahead of time really helps soften the environment for collaboration and sets a tone to welcome mutual respect. And both of those realities really do serve my clients. I've had the privilege of providing volunteer doula care support in local hospitals and getting to know nurses and midwives and OBs and learning how to better serve my clients while also supporting medical staff. My experience with medical care providers in the hospital space has been that they largely appreciate doulas in the birthing space because they know that their patients are being well tended. And when providers are less receptive to the presence of birth doulas, I see it as an opportunity to change their perspective through my approach to care. I believe in proactive relationship building within the care community. So I regularly refer my clients to trusted practitioners within the hospital context and with and outside of it. It's important to me that we as doulas really elevate every opportunity for wraparound care, especially for our historically under-supported community that we love and that we serve.
Thank you, Kris. Thank you for giving us that overview of what doulas do and how you show up in the work. And I think it's really important that you weaved in your personal story because a lot of times in this work, it's our own personal stories that bring us to this. It was my experience with pregnancy and infant loss that helps me stand up in this work. Next, Pam, please tell us what is the role of an OB? Where does one practice? And tell us a little bit about your personal approach and what brings you to the work. And then a little bit, we'd like to hear about how you work as a part of a care team, if you can weave that in.
Okay. I am first very glad to be here and part of this discussion. Kris, you opened my eyes to some things even with that introduction. So I would say that I'm an OBGYN and almost everyone on this call knows fairly well what an OBGYN does and is. OBGYNs are surgically trained, so we provide care for women, only women, along the continuum of their life. So from adolescence through fertility, through childbearing, through menopause. So we treat medical and surgical conditions. Though I hope that at the end of our discussion, you will see the differences, some stark and some not so stark, between having a pregnancy managed by an OBGYN and that of a midwife. I have been with Atrium and delivering care for over 30 years. And one of the things in terms of my personal journey to this work is because I work with the underserved. I am a woman of color and give care to women of color. And therefore, over the last 10 years, I would say, you cannot be a Black woman physician and not understand the crisis of maternal health that we have in our country. And as such, I'm not going to say the end of my career, but perhaps the tail end, winding down of my career, I have become so engaged in the work of birth equity. And some of my connections with this group, with UNCC, with the Maternal Child Health Network, with the Perinatal Access to Care Network has brought me to these relationships and these endeavors. So what I would say is that it's very important to have a physician at least have some purview in a pregnancy. And as Kris said, and then as I'm sure that Nicole will talk about, that we can be a team. We can be a team. And I am not going to elevate one level of care above another, because as Kris also said, care needs to be wraparound and the patient needs to be at the center of it. I really do think that because of the glaring disparities in maternal morbidity and maternal mortality, OBGYNs are starting to rethink why we do what we do and how we can, more importantly, provide patient-centered care and take into account patient autonomy and advocacy. But amidst OBGYNs, I would not say that that's a uniform calling. I don't think that that's a uniform thing that is happening, but there are definitely individuals who are seeking to provide that. Um, like Nicole, I am the daughter of a Black woman who was a family practice doc who delivered women. She was the first Black woman in my town to provide obstetric services. So I grew up having equitable care modeled for me. So it's not unheard of that now I work taking care of women of color, largely underserved, and want to put them at the center of what I do. And I do not want to take up any more time from Nicole, so I will stop there.
Thank you, Pam. Thank you for sharing that. And I really like the way that you elevated the ways that folks are providing care are changing, and it is possible to work and that you like to work as a part of a care team to make sure that patients are at the center of the care that they're receiving. That's the most, I think, one of the most important things. So Nicole, we're going to jump into some of those same questions with you. Please tell us a little bit about who you are and what is the role of a midwife, where we can find one practicing, and a little bit about your personal approach. What inspires you in this work? And then just tagging on, like they have as well, how you work as a part of a care team with a doula and OB.
Thank you, one, for having me here and creating this space for midwives to be and to speak. I think it's really awesome that both of these wonderful women came from backgrounds of other wonderful women who put them into these spaces. My background is similar, even though I didn't know it before I became a midwife. I come from a line of midwives in Jamaica. And so this has kind of always been a work in me and a work that I've been called to. I am a mother of two, a 4-year-old and a 9-year-old, and they keep me very busy outside of midwifery. My birth experiences were very different from one another. The first one, I was very young. I didn't know which questions to ask, and no one was asking me any questions, and so I just kind of did whatever. Did have a good outcome, but not a lot of support or anything of that nature. You don't know what you don't know, basically. The second time around was 2020 in the height of COVID, in the height of Black maternal health crisis and all the things, lots of anxiety and fear. Even in being a midwife, there was a certain amount of fear and anxiety going into a birth space. And a certain amount of, even with the colleagues I worked with, they weren't actually listening to what I was saying and how I was feeling. And thankfully, again, we did have a good outcome, but, coming from a background of a person who does know a lot, I'm afraid for folks who don't know much and are speaking in those spaces. So at the very core of what I do, I do it for those humans who might not know what to ask, which questions, what interventions are, and how they affect us, or even know that they deserve a voice in that space, so to speak. So that's kind of the core of midwifery and why I do this. I did start out as a nurse and kind of fell into this space of women's healthcare. Again, like I said, I come from a line of midwives, and it just kind of worked out in that way. A lot of what I do is education based at the time. Right now, I do work like part-time as a practicing midwife at the bedside, but most of what I do right now is about advocacy and helping folks who are in a space of uh, disadvantage, so to speak. Some of those bad outcomes that we see, I'm serving that population right now, and it's very fulfilling to be able to be on this side and promote doulas and promote community healthcare workers, because they do a lot of work in this space as well, and I want to really kind of elevate them. As far as a midwife and what we are and what we do, it is kind of the in between doulas and OBs. We are clinical professionals. I want to say that there are a couple of different types of midwives, but at the core of it all, we kind of have the same belief system of how to care for humans, right? And so midwives, like OBs, we care for women throughout their entire lifespan. So preconception to menopause and through menopause. The key there is low risk, as Dr. Cobb said. There is there's definitely an advantage to having a physician around when there are high-risk situations, having a sounding board, someone to ask questions to. Midwifery is kind of limited to surgery, right? And so everything up until the point of needing a surgical procedure, we can do and be a part of. A lot of my work is collaborative with physicians because as we all know that, in the space of labor and birth, things can change fairly quickly. And physicians have been some of my best and most trusted allies in those spaces and in those cases. So um, I just kind of always want to put that out there that we're not against each other. We're here to work as a team always, right? So going back to the different types of midwives that you might find, when we think of midwifery, we're almost always going to think of the certified professional midwife, that midwife that's in the community, that, is going to folks' homes and seeing them throughout that prenatal period, delivering in homes and within the community. Um, Unfortunately, in North Carolina, legally, they're not recognized in the state. That doesn't mean that they don't exist in the state. It doesn't mean that they're not serving women in our communities. There's actually a very robust community of CPMs, and we learned everything that we know from them, right, off of the backs of them. We also have certified midwives who are midwives who have taken, actually, let me go back, certified professional midwives. They learn within the community, right? They learn from other midwives who are very well versed in what they do. They have to do a very large number of births before they ever get certified, and they have a lot of experience there. Certified midwives typically will have a degree in something other than medicine and then go back for a master's degree in midwifery. And then the certified nurse midwife typically start like I do, go to school to be a nurse, and then go for a master's degree. All of us answer to certification boards. We all have to renew our education every 5 years or so. We have to stay abreast of the most recent standards of care. So I kind of like to put that out there so that we know that midwifery is safe care, right? There's been kind of a narrative over the years that midwifery care is not safe care. And just kind of, I don't think a lot of people know that there's a lot of education that goes into this. There's a lot of, um, you know, like evidence-based care that we're following, right? We're not just doing it because this is what people have always done. We're constantly trying to figure out how we can make things safer for folks. When you speak of midwifery, you're typically going to think about within the perinatal period, during pregnancy, prenatal visits, labor, birth, and then postpartum. So we see people for all of those. Um, and the midwifery model of care is holistic, is patient-centered. We focus on trust building with members. We focus on shared decision making, which kind of goes back to brain, where Kris was saying, we talk about the benefits and the risk and the alternatives to any sort of medical decision making that the patient might be encountering. And then we try to promote physiological birth. One thing about midwives is we're trying to get everyone in the entire birth community to see that birth is not a disease, right? This is something that is a part of our normal physiological process with our bodies. And most of the times, if we leave it alone, it does go well. But the reality is that we do live in a country where people are sicker than most countries, right? And so some people are gonna enter into pregnancy with comorbidities. And in that case, that's where collaboration comes in key. And then we're promoting people's health from that space, right? Um, like I said, our skills are limited to surgical procedures. You might find midwives working in hospitals. In fact, in North Carolina, you're going to find the majority of midwives as CNMs working in hospital systems. We do have two birth centers in North Carolina, one on the coast in Jacksonville, and then one in Statesville. we used to have a lot of birth centers, and we are really trying to get those back into play. But for the most part, we have two that are freestanding from hospitals and have midwives caring for folks there. And then there are some midwives in the community, like I said, who are out there doing the work and seeing folks at home and delivering them at home. There are a handful, and I don't even want to say a handful, there are a few CNMs who are doing this as well. There have been some changes in the laws in North Carolina. We went from a supervisory practice to a collaborative practice, and that really opens up access to care for people, specifically in two forms, because, you know, like I said, with CPMs not being acknowledged in the state as practicing legally, that when people are living in rural areas, it really limits the access to care. It limits access to care financially, because if your insurance is not covering that provider, then maybe even if you want a home birth, you may not be able to pay for that. So opening up the lines there for CNMs to maybe more freely practice is really important, but even more so important to continue the fight to get CPMs also acknowledged. I wanted to say also, you know, because we talk about the Carolinas, South Carolina does allow for CPMs to practice freely. So that's always an option as well. How to find these professionals can be tricky. It depends. With CNMs, pretty much, like I said, if you, any of the OBGYN practices in your area, you can look there and they will have them listed on the website. I also just want to warn folks, if they're patients, that, you know, you might start out with midwifery care, and go all the way to the end of the birth with a midwife, but in some cases, if you've had high-risk pregnancies in the past, they might want you to see a physician somewhere in that prenatal visit. Also, that providers are on call. We can't work all the time 24/7. And so you might attach to one provider and see another one somewhere during your labor and your birth. And that's important to know, that doulas are really important in that space as well, because there's a bit of a grounding there of someone that you know and that you trust and that you know will help you advocate for yourself, even if there's a new provider that's brought about in that space. And I kind of already talked a lot about how I work with my counterparts, doulas and physicians. I really, really want to say that a full team is a team, with doulas included. And doulas can sometimes be your family member, the person who's been with you your entire pregnancy and knows the things that you want for your birth. And you've had these discussions and you're sitting with them and talking about, you know, if this happens, then that it's not always so concrete. Um, but I really, really enjoy working with both of these colleagues, physicians and doulas in this space. And it is very necessary for women who are of color and or that we know are at a disadvantage in the hospital a lot of the times. I want to make sure I covered everything. I think that's it. Was that all the questions you asked?
Yeah, that's all of them. I mean, and you actually jumped a little bit ahead. So thank you so much. And I think what you actually what you're bringing out is, when we started planning this conversation, we knew that 1 hour was not going to be enough time. So my mind is blown just right here on this conversation. We're definitely going to have to pick back up and probably have at least a part 2 of this conversation. So you guys make sure you stay in contact with us. But all three of you all kind of brought up something really important in you all's personal journey, basically, that you don't know what you don't know. So as we think about that and lean into that, I want to ask each of you, what's one piece of advice you would give folks about creating your care team? And Pam, I'd like to start with you.
I think that if we believe that equitable care is patient-centered, then you have to, as the woman at the center, as the birthing individual, have to create a team that supports you. Overwhelmingly, just like Nicole said, that usually is partner, friend, sister, mother, and then doulas. So you have this community of support, and I would love to advocate to bringing those individuals to prenatal visits. Maybe not all of them, but at least one or two of them, because you never want to have a conversation with whatever provider you have the first time when you're in labor. You never want to have a conversation about what your desires are, what your hopes are, how you see what's important to you. You need to have those foundational conversations during your prenatal care. And unfortunately, if your provider doesn't bring it up, you need to bring it up. And a lot of times women need that support, need that friend with them to be able to say, didn't you just tell me out in the car that you wanted to talk about this? When things went out of their heads, or when they felt they felt stressed. You need an advocate to say, no, that's important. She's not going to think you're crazy. So I think definitely partners, family members, and then the provider. Again, a birth plan is not a bad word. And I think that sometimes, particularly for OBGYNs, I think birth plans get a bad rap, because the idea of having a birth plan and having a sense of, I want to be in control, that is a conversation that's new, guys. That is new for OBGYNs. And part of these meetings is about discussing those things. What's feasible? I'd like to eat until I'm 8 centimeters. Is that okay with you? I would like to walk around until I'm 8 centimeters. Is that okay with you? When would that not be okay? So in a nutshell, that's what I would say. Basically, have all the conversations and at least bring your support team once, twice, maybe 3 times to a visit.
Thank you. And that's really important. So in terms of building your support team and your care team, including your family and bringing them to some of your doctor's visits so that they can help advocate for you and help you advocate for yourself. Nicole, can you answer that question? What's one piece of advice you give to folks as they build their care team?
Okay. I will settle on one piece. And that one piece is that, you have choices regarding the way that you experience your birth, right? You have choices and you have rights about how you would like to receive healthcare. And like Dr. Cobb said, that's really foreign to folks in the hospital, right? That you ask questions and also tell them what it is that you want, and take ownership of that birth space as your own space, and that they're kind of entering into that space. That is actually right. You have a right to know the risks, the benefits, alternatives to anything. And again, to Dr. Cobb's, what she's saying is that education should not start in the birth space. That education should start within the prenatal visits, and even sometimes preconception. Like, if you know that you want to have a baby, this might be the time to ask some of the questions that, are on your mind. And then also all of us having grace with one another, because the way that the system is set up is that these visits are short, guys. And so bringing those questions to the visits and saying, if we don't talk about anything else in this visit, I want to discuss this thing, is very helpful to the entire team. My greatest wish, honestly, is that, we as Black mothers don't have to come into a space with anxiety and fear of harm. And that includes educating one another and supporting one another. Each one teach one kind of situation. Because again, like I said, money-wise, we don't always have the funds to hire a doula. As wonderful as you guys are, sometimes, it can be out of the reach of folks. So that's my one.
Thank you. So the one piece of advice again is you have choices, and to educate yourself and begin educating yourself at various parts of the journey, even in preconception, if that's something that you know that you want. So Kris, what's one piece of advice you would give to birthing families as they develop their care team? You got to unmute.
Can you hear me?
Yes.
Perfect. Everyone touched on such beautiful things. And this is a hard question to ask with one piece of advice. But know that you're going to need care that is not given as standard here on this soil. So let her story tell the story. We know better, right? So if you are not yet pregnant and you would like to be, start gathering the information and the resources that you need to build the care team that you hope for when the time comes. And if you're pregnant now, proactively build relationships with your care providers early on. Like Dr. Cobb said, education, we hope, is happening far before you get into the birth space. And so speaking of that, thinking about doulas in particular, many doulas offer other services, including childbirth education, and they really do highlight, and they have other often specialties that you can draw from that can help you really create what it is that you're hoping for once you have journeyed through and you're in that space. A doula is the one person on your care provider team whose sole focus is you, and who provides continuous support. And so where midwife and OB might be inside and outside of the space, the doula is there, and they know you, they've gotten to know you. And so it's really, really important to find grounding in that kind of experience. I want to also mention that it's important that when you surround yourself with people who respect your choices and they treat you, and you're building this care team, you want to know that the other people in your family, including your spouse, your partner, your children, if you have others, are also respected. And listen to yourself and what that feels like when you walk in spaces. Are providers making eye contact with not only you, but also with the people who you're their world? They matter too. And so we want to design teams that take an approach of care for this person's community, for your community. Also, if you're curious about the experiences of other Black and Brown women who are building their care teams and who have gone through, visit the Earth app. That's IRTH, where you can find prenatal, birthing, postpartum, and pediatric reviews of care, and leave reviews when you've had care experiences of your own. We need to hear from each other. We need to hear our narratives, and we need to know where we're safe and supported, and where we need to leave, like our grandmothers might say, like, well enough alone. And remember that your body, your baby, your family, and your birth is yours, and you deserve a care team that honors and that elevates that.
Thank you, Kris. So we are going to move into, I think we're going to skip ahead and move into, I think one of the really important conversations or questions for this conversation is, how do we pay for these providers? Where do we talked a little bit about where we find them? How are we paying for them? And Kris, you've mentioned, the different places that we can look. Can you start off by telling folks how they can find and pay for a doula? And I know there are many, many ways. So just a couple highlights.
Okay, here we go. I'm gonna talk like fast because this all matters. Okay, so how do you find a doula? Ask for recommendations from your friends and family, whose opinion you trust. Ask your midwife and OB if they've worked with birth doulas that they recommend and have worked collaboratively alongside. The majority of my private clients have made their way to me through personal and professional referral. So it's just a good way to find a doula. Search for doulas online. You can read local social threads and search social media tags. You can Google Black doulas in Charlotte, North Carolina, or wherever it is that you live. You can search online directories like System Midwifery and Baby Dove have an online Black doula directory. And the National Black Doula Association also has an online doula directory. You can reach out to organizations like Mama Glow or Ancient Song. These are organizations that are lifted by powerful Black women, mothers, and entrepreneurs who have trained Black doulas and whose organizations provide matching services. You can search and attend classes, events, and support groups, tour birthing spaces. Doulas are regularly in attendance at these kind of events. If you're choosing birth at a Novant hospital, you can meet independent doulas who are Novant verified, which for you means they have incredible access to Novant facilities. They're considered team members, and they're able to support you in triage and in operating rooms. And you can find some fantastic doulas who are Novant verified at novantbipocdoulas.com. And from anywhere in the US, you can reach out to me and inquire about birth continuum guidance and doula support at motherofthese.com. How can I hire a doula? The majority of doulas are independent practitioners and solopreneurs. And also many doulas, work in the partnership with another doula or as part of a collective or collaborative or agency of doulas. So after you've identified doulas that you're interested in knowing more about and possibly working with, you can set up consultations. Many doulas provide a complimentary call, and some charge a nominal fee that goes towards your doula support if you choose to work with them. Find out what each individual doula or agency provides and ask them questions that matter to you, not to the internet. How can I afford a doula? What a question, right? So I want to start by saying that doula care is a valuable and a worthy investment. And I want to say that part first for the sake of my colleagues and really for our profession and how I know that we show up and how we pour out and how we care for our clients and for our community. And it must be noted that, this work is a privilege for us, but it's also a heavy lift. It's one that we carry with pride and also with challenge, because as we too live in this place that seeks to weather us, it's worthy work. For people on this call who are change agents and advocates for Black maternal and family health, tell everybody to find the ways and the dollars to pay for doulas, period. Speaking in relation to birthing folks, people who are actively searching for care or who are hoping for this experience, this journey in their life, save money ahead of your pregnancy or birth to hire a doula. If you did it for your graduation party, if you did it for the new album and on tour and the outfits and the plane tickets to get to the concert, if you did it for your wedding or your last vacation, you can do it for your journey to and through birth. It really does. It matters. It's huge. It's a huge deal. And it deserves preparation, and you deserve support. You can create a mother registry instead of or in addition to a baby registry. You can ask your friends and family to put funds towards your doula services and other important support needs like meals and laundry services and postpartum doula services. Organizations like Be Her Village are perfect for that, and they're free to use. HSAs and FSAs typically cover doula support at 100%. Some workplaces and organizations like Walmart reimburse for doula support for their employees. Some insurance companies cover a portion of birth doula fees. The majority do not. So some states cover doulas through Medicaid. Washington State has set their state certified doulas Medicaid for birth support payment at $3,500. It's the highest in the US and really should be considered the minimum for all states to follow. Some doulas offer sliding scale fees on income, or some doulas offer payment plans. that allow you to pay in installments. There are community-based programs that offer pro bono or low-cost services to families in need through public grants and with private funding. And you can research organizations in your area. The Hello 7 Foundation, Baby Dove's Black Birth Equity Fund, and other organizations provide grants to help folks fund this life-changing and vital support that doulas provide.
Thank you, Kris. So many resources out here to support. And she ran off a laundry list. And like she mentioned, the resources vary from place to place, but there are many ways that we can prepare for birth. And it's one of the biggest things that we do in life. So why not prepare as much as we can? Pam, really quick, because I want to try to jump into a couple of these questions. How do folks pay for OBs?
Goodness. You have to have a baby, right? And so whether you're insured or not insured, there will be an OB that will take care of you. And it's me. But in general, OBs are covered by your insurance, your second party payers, Medicaid, and if you are paying out of pocket, which many of my patients are, we do not turn anybody away because they can't pay for care. So ultimately you end up with a very, very big bill from the hospital system. In full transparency, yes, you will, if you are paying out of pocket. But again, that you've got to have a baby and you've got to have care. So that's it in a nutshell.
Thank you, Pam. And Nicole, can you bring us home and tell us, you've told us a little bit about where we find midwives, you told us a little bit about how to pay for them, but can you just bring that home? How are folks affording and paying for midwives?
I'll first say that I wanted to add, I know Kris was saying that insurances don't pay for doulas that well, but even though North Carolina has not kind of jumped on the bandwagon of Medicaid paying for doulas fully, some of those managed care providers will. So like Healthy Blue, for instance, that we work with, for my job we work with, they will pay for doula services for those members. So just if you are using Medicaid insurance for your pregnancy, just call your managed care provider and see if they'll do that. Okay, and then how do you pay for midwives? The really exciting thing in the last few years is that, they were not reimbursing midwives 100% insurance-wise for the care that they were providing. They do now, right? And so the same thing that Dr. Cobb said is that, if you do have insurance, and your insurance should cover it should fully cover midwifery care. If you are going to a birth center, that can be a little bit different because you may need to put a little bit of money down up front. But usually that can be rebated to you as well. So really just working with whatever agency you decide to go with, even if you are with a CPM, they typically will work with you over time to help you pay that down over time.
Thank you. So we packed a lot of information into this little bit of time. I'm going to try to turn it over to Alicia as I answer a couple of the questions that came in. We got someone asking to share more information about the changes from a supervisory team to a collaborative approach. I think we talked a little bit about that, but somebody I think maybe wants a little bit more. We did get to speak a little bit about navigating situations where the provider you see at delivery is not one that you've seen during your prenatal care. And like the providers mentioned, sometimes they work on call, so that's not always possible. But again, in building this birth team and building your care team, a doula is somebody that you can ensure that will be there throughout the duration of your pregnancy. That's one person that is hired solely to support you. So as you think about building your care team, consider how you can have a doula to help you navigate specifically those things. Is a doula ever covered by insurance? So yes, we talked about that just a little bit. But again, I think you guys are going to have to come back and sit with us again to hear some more because there's so much information about this topic. And I see folks asking about creating teams. So definitely make sure you drop your contact information so you can stay plugged into the work that we're doing and how we're continuing to share information with the community. Thank you all so much for joining us. Alicia, I'm going to turn it over to you to close us out and share some announcements and resources.
Absolutely. Thank you all so much for sharing your wisdom with us on this Friday. And for those of you who are taking the time out of your schedule to be here and engage in this conversation, we are really grateful for this. I did want to mention folks were entering at all different time points today. So I want to say thank you especially to our partners. So the Charlotte Maternal Child Health Work Group, I'm going to show you a slide here that covers what we do. We are a group of folks at UNC Charlotte who have come together to try and build connections with folks in the community, folks at other institutions, and within our own organization, covering a broad range of topics related to maternal and child health. If you would like to join our email list, you can scan that QR code or check the chat for a link to sign up. We often are trying to put together some of these educational series. So if you have ideas for what we should be talking about next, please let us know. It sounds like we already have an idea to continue this conversation, so be on the lookout for that one. I did also want to plug the new resource through Atrium Health. Dr. Cobb had mentioned the Perinatal Access to Care campaign. And so this is a community resource hub that has been a huge partnership and collaboration with folks all across Mecklenburg County. So please go ahead and check that out if you're able to, and help to spread the word about this resource. And then we will be sharing, I put these in the chat already, but we'll be sharing these with you in an email, in addition to the list of resources that were rattled off today. We have so many that we want to compile and be able to share with you after this session. So here are a few. If you want to grab one or two of these QR codes to get started, we'll be sure to send you this information via email. If you registered, you'll get the info. And then lastly, we have some upcoming events in the community that we wanted to plug here. So Jace's Journey is going to have their 6th annual 5K. If you're around for that, please join them. And then we also have this Healing Through Pregnancy Loss session coming up in October. Again, we'll send all of this in an email to you. And I want to say one more time, if you want to react, if you want to throw some good vibes into the chat for our panelists today, Racquel Washington, thank you so much for being here and moderating for us. Kris Elle, Pamela Cobb, Nicole Parchment, we are so grateful for your perspectives. And on behalf of the Charlotte Maternal Child Health Work Group, I see some of my collaborators on the call here, Dr. Hopper, and many students like Shanika who helped us to pull this together today. Thank you all, and we hope you have a great rest of your weekend.